Welcome to the Certified Nursing Assistant Training Program Advising Session. Goals for this advising session: making an informed decision about enrolling in the Certified Nursing Assistant Training Program. How to complete all required documents for registration in the NURSA 1105 course. How to fulfill all pre-enrollment requirements. Register prior to the close date for the program. Please note that registration for this program is first come, first serve. So please complete all steps as soon as possible in order to secure your seat. Upon completion of this video, you will submit a quiz to nursinghealth@cod.edu to receive credit for attending the advising session. Please fill out your name and email address when you submit this document. Please watch the full advising session, and after the video, fill out the form on the web page and complete the quiz. If you did not score 100%, you will not receive credit for completing the advising session requirement and must retake it. Upon completion of this video, you will submit a quiz to nursinghealth@cod.edu to receive credit for attending the advising session. Please fill out your name and email address when you submit this document. Please watch the full advising session, and after the video, fill out the form on the web page and complete the quiz. If you did not score 100%, you will not receive credit for completing the advising session requirement and must retake it. What is a CNA? A CNA, or Certified Nursing Assistant, is an entry-level member of a patient's healthcare team, performing important patient-centered tasks under the supervision of licensed nursing staff. Although a CNA is not a nurse, they work very closely with nurses, physicians, and other healthcare providers. Becoming a CNA is the path that many people take to start their career in healthcare. Some may move on to more advanced levels of nursing or other healthcare fields, while others are satisfied with the many rewards of working as a CNA. Where to find CNAs? Almost everywhere healthcare is offered: long-term care, acute care, rehab, even clinics. Although the focus of this course is on the geriatric patient, there are some essential functions you must be able to perform. They include motor sensory capability, move from room to room and maneuver in small spaces, squat, crawl, bend, stoop, reach above shoulder level, use standing balance and climb stairs, lift and carry up to 50 pounds, exert up to 100 pounds force, push-pull, use hands repetitively, use manual dexterity, sufficient fine motor function. Must be able to walk and stand for extended periods of time, perform CPR, travel to and from academic and clinical sites, coordinate verbal and manual instruction. Ability sufficient to hear verbal communication from clients and members of the health team, includes ability to respond to emergency signals, discern soft sounds, such as those associated with taking a blood pressure, visual acuity to acquire information from documents, such as charts, comfortable working in close physical proximity to patient, communication problem-solving ability, communication effectively in English with patients, families, and other healthcare providers, both verbally and in writing, effectively adapt communication for intended audience, interact, establish rapport with individuals, families, and groups from a variety of social, emotional, cultural, and intellectual background, assume the role of a healthcare team member, function effectively under supervision, sufficient command of the English language in order to read and retrieve information from lectures, textbooks, as well as understanding medical terminology. Skills include computer literacy, function effectively under stress, respond appropriately to emergencies, adhere to infection control procedures, demonstrate problem-solving skills in patient care, measure, calculate, reason, prioritize, and synthesize data, use sound judgment and safety precautions, address problems or questions to the appropriate persons at the appropriate time, organize and prioritize job tasks, behavioral skills and professionalism, follow policies and procedures required by academic and clinical settings, adheres to COD academic honesty policy, per college catalog, adheres to COD code of conduct, per college catalog, abides by the guidelines set forth in the Health Insurance Portability and Accountability Act, HIPAA, the National Privacy Act. College of DuPage's CNATP is a great place for you to prepare for an entry-level position as a certified nurse assistant, CNA, and/or pre-enrollment education for healthcare-related programs. You will find an outstanding level of support and commitment to your certified nursing assistant training and education at College of DuPage. American Healthcare Association BLS provider training is built into the course. With our focus on a competency-based curriculum, you will need to embrace the exciting yet demanding curriculum designed to prepare you for the challenges of nursing assistant practice. Continuous, thorough study is essential to master this program and to prepare you for safe and effective practice in the years ahead. The CNATP faculty encourages you to make full use of their support and the college's resources while on your educational journey and career path. We will share in your joy as you complete the program and hope that you will remember College of DuPage as the starting point of your professional healthcare career. Students must complete the registration checklist. Please refer to the registration packet on the CNATP website to be granted permission to register for the Certified Nursing Assistant CNA program. Registration is on a first-come, first-served basis, so please complete all steps as soon as possible. Essentials needed for course. Current College of DuPage student. To become a COD student, visit admissions.cod.edu. Reading placement test or meet specific criteria. Health requirements. Edward Corporate Health Chart Review. Drug test. Must be completed within 3 months of program start. Medical document manager through Castle Branch. Health insurance. A completed healthcare worker criminal background check form. Found on Castle Branch. Registration and payment after registration. A clear background check is required. Program costs and supplies. Please reference the CNA Program Costs website for details. Upon completion of this video, you will submit a quiz to nursinghealth@cod.edu to receive credit for attending the advising session. Please fill out your name and email address when you submit this document. Please watch the full advising session, and after the video, fill out the form on the web page and complete the quiz. If you did not score 100%, you will not receive credit for completing the advising session requirement and must retake it. We recommend using a physician covered under your health insurance plan, as this will be the most affordable option. Step 1. Contact your physician to set an appointment for a physical exam and vaccination evaluation. Please reference the CNA registration packet and health requirement packet for details. Step 2. After you visit your physician and have all your vaccination and titer records, please schedule an in-person chart review with Edward Corporate Health, ECH. Please reference CNA registration packet for required ECH locations. Step 3. Leave ECH with a completed chart review. The drug test and medical document manager must be ordered through Castle Branch. Please refer to the CNA registration packet for additional details. Please note, the drug test must be completed within 3 months of program start registration. Once the drug test and the medical document manager are completed, you will be granted permission to register via your COD student email. Please note that registration is first come, first served. You will be entered into the Illinois Healthcare Worker Registry based on information on your healthcare worker background check form. Fill out accurately, legibly, and with legal name. Make sure all information is correct. Fingerprinting for your background check will be completed during mandatory orientation. Here is a breakdown of areas the CNA student will be working on: practical skills, theoretical knowledge, soft skills, and compliance are the key areas where a CNA should excel. Course format includes weekly learning modules, complete via Blackboard, 2 face-to-face meeting each week, lab with class, 1 8-hour clinical session per week for 6 weeks, on-site work experience. The Illinois Department of Public Health, IDPH, mandates that all students attend allocated hours of theory and clinical instruction, as well as demonstrating manual skills competence in order to be eligible for the state certification exam. College of DuPage complies with this law and has written the program to include the prescribed number of instruction hours and break time to meet all laws regulating the program. The CNATP requires students to attend all instructional and clinical time, as well as passing grades on all aspects of the course. Therefore, attendance at all theory classes and all clinical session is mandatory. Classroom and lab. Students must call or email the instructor if they will be absent or tardy to class. Students are only allowed one total absence from class/lab for the entire semester. Any time missing must be made up. 2 tardies equal 1 class/lab absence. Students with more than 1 absence from class/lab will be removed from the program and will earn a failing grade in NUR 105. Please look at the dates of the course prior to registering. Make sure you can attend the course you register for. A passing grade in both the theory, lecture lab, and clinical components must be achieved in order to sit for the Illinois State Competency Exam for nurse aides. Students must competently demonstrate all skills mandated by the Illinois Department of Public Health Regulations in order to pass the course. The list of the skills with detailed guidelines is in the CNA Student Handbook. Clinical is a pass-fail grade. Once you receive permission to register, please follow the below steps in order to enroll in a NURSA 1105 class. 1. Go to inside.cod.edu. Go to My Access for Students on the left-hand side. 3. Choose registration and search for classes. 4. Fill in minimum of 3 fields. Example, term equals fall 2025, subject equals assistant, course number equals 1105. 5. Choose Submit at the bottom of the form. You must attend all days that the class meets and complete the mandatory CNA student orientation. For additional help enrolling in the CNATP or questions about the program, contact Nursing Health at cod.edu. If you need help with academic planning, contact Healthcare Advising at cod.edu. You must attend all class sessions, including the mandatory orientation. An average of 80% must be earned in 3 grading areas. You must maintain an average of 80% on exams 1 through 6 to stay in the course and qualify to take the final. All IDPH required skills must be competently performed. Any change in your health requires a doctor's note to continue. If this limits your ability to meet the essential functions, you will need to disclose this and withdraw from the class. In conclusion, the Certified Nursing Assistant Training Program offers a valuable stepping stone for those looking to start a career in healthcare. With the right training and certification, numerous opportunities for professional growth and advancement await. Reference the CNATP webpage for important dates and deadlines. Upon completion of this video, you will submit a quiz to Nursing Health at cod.edu to receive credit for attending the advising session. Please fill out your name and email address when you submit this document. Please watch the full advising session and after the video, fill out the form on the web page and complete the quiz. If you did not score 100%, you will not receive credit for completing the advising session requirement and must retake it.